How did Louise Brown's birth transform reproductive technology's ethics? Imagine a world where the dream of having a child seemed almost impossible for some couples. Now picture that dream becoming reality through a medical breakthrough. That moment happened in 1970, when Louise Brown was born. She was the first person conceived through in vitro fertilization. Her birth changed everything in the field of reproductive medicine. It also sparked new conversations about what is right and fair in using advanced medical technologies. Before Louise Brown's birth, infertility was a tough problem with few options. Her birth showed that it was possible to help couples conceive outside the body. This expanded reproductive autonomy, meaning people could make more choices about their reproductive lives. But it also raised questions about who should have access to these treatments. Should everyone be able to afford IVF? Should it be available only to certain groups? These questions are about fairness and justice in healthcare. The process of IVF involves creating embryos outside the body and then implanting them into the woman's uterus. This raised ethical questions about the status of these embryos. Are they just cells or potential human lives? What rights do they have? These debates led to guidelines about embryo freezing, selection, and disposal. It was a big step in thinking about the moral status of life created in labs. Louise Brown's birth also brought safety concerns. IVF was new, and scientists didn't know all the long-term effects. This meant careful monitoring was needed to avoid harm to mothers and babies. The principle of beneficence, or doing good, was important here. But so was non-maleficence, or avoiding harm. These principles helped shape ongoing safety standards for reproductive technologies. Another key issue was the fairness in access. IVF and other assisted reproductive technologies were expensive. This raised questions about whether everyone could get equal treatment regardless of their income or background. It also prompted discussions about regulating fertility clinics to prevent exploitation and ensure ethical practices. Finally, Louise Brown's case highlighted the importance of informed consent. Patients needed to understand the risks, benefits, and ethical issues involved in these procedures. This helped build trust and transparency in reproductive medicine. In summary, Louise Brown's birth pushed society and the medical community to think carefully about autonomy, safety, embryo moral status, fairness, and honesty. These principles continue to guide how we approach reproductive technologies today, making sure they are used ethically and responsibly.